I'm really honored to be here this morning, and I thank you for the opportunity to testify before the committee in support of H1311 and S761, an act ensuring access to full spectrum pregnancy care, which would mandate insurance coverage for all pregnancy care, including prenatal care, labor and delivery, postpartum care, and miscarriage management with no cost sharing. I want to thank you for previously reporting this legislation out of committee favorably. We will submit some testimony on this legislation as well. So today I really want to use my time before you today to uplift some of the stories from Massachusetts residents who have shared with us in our advocacy in support of this legislation. These are stories from Massachusetts families who are dealing with unexpected and insurmountable debt simply for wanting to start or grow their families. One Massachusetts resident who describes himself and his wife as having graduate degrees and good jobs told us that they will be paying off the bill for his wife's uncomplicated C-section until their child is 4 years old, despite their hospital being in network, and their bill went straight towards their family's out-of-pocket maximum. Another resident was forced to pay out of pocket for ultrasounds necessary to diagnose her miscarriage. She described to us feeling traumatized all over again when she received her bill several weeks after having worked to come to terms with the loss of her pregnancy. Yet another Bay Stater shared with us that she and her spouse made the difficult decision not to have children, in part due to the out-of-pocket costs that they would incur and knew that they could not afford during a pregnancy. Another shared that even though she was fully insured during the time of her pregnancy, her care cost $10,000 out of pocket. She is still paying off the cost of her pregnancy for her child, who is now 4.5 years old. She often thinks about the quality of life that $10,000 could have afforded her child or even herself, and about the absence of a baby sibling for her child to grow up with and love. These stories are unfortunately not unique, as Massachusetts considers how and it can and must continue to be a leader in reproductive healthcare access. It is critical that we recognize and work to eliminate the cost barriers that still exist for people who are seeking to grow and start their families. Pregnancy care should not come with a price tag. Thank you again for the opportunity to testify, and I urge you to offer an act ensuring access to full spectrum pregnancy care a favorable report. I also want to acknowledge Reproductive Equity's support for several other bills that are being heard today and on which we are submitting written testimony, including an act to increase access to nurse midwifery services, an act relative to insurance coverage for doula services, an act relative to transparency of consumer health insurance rights, an act relative to pharmacists as healthcare providers, and an act improving access to breast pumps. Thank you so much.